Hello and welcome to anatomy tutorial part 4. In this we will be talking about the scapula and the uh, bone structure. We will begin first with the scapula. So the scapula is located on the back side of our chest, on the back of our rib cage, on the sides, back and sides of the rib cage. The importance of the scapula is that it is the site of attachment for the arm, the upper limb. For example, here we have the humerus, and this is the back view of the scapula, and the humerus attaches to the scapula. Furthermore, the scapula also attaches to the clavicle. So let's look at first start off with the front view. So as you can see here, you cannot see scapula very clearly here because the rib cage is shown here as well. But it gives you an idea of where it is located. So you have a rib cage. Remember from the previous tutorial where we talked about the clavicle and the rib cage. So this clavicle attaches to the manubrium here, and the other end continues and attaches to the scapula. Okay, a portion of the scapula here, this is called the acromion. And the joint of the acromion with the clavicle is called the acromioclavicular joint. Okay, so that is the acromioclavicular joint. Next, we also have a process on the scapula. So again, this is a front view, looking at it from the front. This is a process called coracoid process, and it serves as a site for attachment of various muscles, including muscles that go to the rib cage and muscles that go to the arm, such as the biceps, the short head of the biceps, which we will get to later. So this is the front view. Now I will show you a simpler picture of the front view. So here is a simplified drawing of the scapula. Just ignore this line here. So this is the front view. As you can see, there is the coracoid process, the acromion, clavicle, acromioclavicular joint. This here is the medial border, medial margin of the scapula. Okay, medial means towards the midline. So you can think of this as being, this is where your humerus would be, your arm. So this is towards the vertebral column here. Medial means towards the center of the body. And the lateral margin is here, lateral to the side, away from the midline, towards the arm in this case. The lateral margin, the medial margin. Two angles here, the superior angle and inferior angle, or superior-inferior scapular angles. Okay? Next, we have very important structure, a cavity here, a cavity or fossa called the glenoid. You can pronounce it whatever way you would like to. This is the glenoid fossa or the glenoid cavity, and it is because the humerus, the head is like a circle, like spherical in shape. It fits right into this glenoid cavity. Okay, like a ball and a socket. It's a ball and socket joint. We won't talk about the joints at this moment. Okay, now we will look back view of the scapula. So this here is the back of the scapula. As you can see, so you have now which margin or border was this be, lateral or medial? This here, it's the lateral. See, it's away from the midline, it's towards the arm. The vertebral column is here. This is the medial margin, lateral, medial, inferior, superior angle. There is the coracoid process. You can see it a little bit. This is from the back. Okay, up here we see, there it is. We're seeing just the back portion of it here. There's the clavicle, acromion. Just this portion is the acromion. So this here is the acromioclavicular joint. This point here. And finally, this here is a prominent structure on the back of the scapula, and it is called the scapular spine, or you can say it's spine of scapula. It's a spine of scapula. Okay, it starts off about this, just above the midline, and continues upward and up and laterally to form the acromion, and the acromion will then join the clavicle. And so this here is the lateral view of the scapula. Looking at from the side, this is the glenoid cavity. So the arm would be here, attaching, like if my finger is the humerus, I would be attaching it like this and moving it. Okay, like that, all happy and dangling. Okay, so here is my is the coracoid process, and this is the scapula, the bottom portion, this area here. There is the acromion, and as the rest of the scapula. So, and then finally, one more thing to note here is that the back of the scapula is very concave, like, okay, it protrudes outward, and this here, the front, is concave. So this is convex and concave, is this anterior portion is concave. It goes inward, and the reason for it going inward is because the ribs are going to be in this thoracic cage, is in this region, the rib cage. Okay, so it's kind of like, you can, like, pushes it in. It's concave. Now we will look at the name of this surface. This anterior whole, the big anterior surface of the scapula, is called the subscapular fossa. Okay, that's the subscapular fossa, as subscapularis muscle is located in that region. And along the back, this scapular spine separates the scapula into two parts: supraspinous fossa and infraspinous fossa, for supraspinatus and infraspinatus muscles.